comment on fasting, Dr. Cavan?
Yeah, so I'm a great fan of intermittent fasting. I have a number of patients who use it as part of their regime. One of the main reasons for doing so is to lose weight and to counter insulin resistance, or as you put it, to increase their insulin sensitivity. And the vast majority are people with type 2 diabetes, where fasting, and in its simplest form, it means missing breakfast and having a 16-hour fast. And to some people, very often people, I'll say, oh, are you hungry in the morning? Do you like to have breakfast? And they say, no, I only have breakfast because I've been told I must have breakfast. And they find it very liberating when I say, well, look, skip breakfast, it's actually good for you. So I have no problem with it. I have no problem with people having one meal a day or going on prolonged fasts, as long as they know how to manage the impact of their medications, which in the context of someone with type 1 diabetes obviously is their insulin. So yeah, no issue with it whatsoever. In theory, if your basal insulin is correct, you can have a prolonged fast and it will not cause you any problems. In practice, in a lot of people, they're having too much basal insulin. And if they have a long fast, they will become hypoglycemic. So I would say before embarking on a prolonged fast, do a fast maybe for 12 hours or initially 8 hours during the day, and just watch what happens to your glucose level. If it stays stable, then you're quite safe. Your basal insulin will not cause you a problem if you have a longer fast. If you see that after 6 hours your glucose is dipping down, then you need to reduce your basal insulin. It is essential for someone with type 1 diabetes who wants to fast, and I have no problem with it, but they need to be sure that they are not having too much basal insulin before they do it. That's all
I always say the CGM is a great device to have, because you're monitoring your blood sugars and you're making sure you stay in safe range, but also glucose tablets.
Yeah.
Have them with you at all times, because you are going to drop low until you find out what works for you, how much basal insulin works for you.